reproductive system because they're easy. So you got that one down there you can look at too. When we start with the male reproductive system, this outer part here is the scrotum. This is the testy. This is the epididymis. And this is the ductus deferens. Anatomically, clinically, we call it the vas deferens. Vas deferens comes up, goes over the top of the urinary bladder and goes behind the urinary bladder. See where it enlarges right here? That's called the ampulla of the vas deferens. This structure next to it is the seminal vesicle, or the seminal gland. The seminal gland and the ampulla of the vas deferens join, and that tube right there, see it right there? That is the ejaculatory duct. The ejaculatory duct empties into the prostatic urethra. Then after that, it's what we already know. Prostatic urethra, membranous urethra, penile urethra, and over here you can see the fossa navicularis. This opening is the urethral meatus. When we look at this is the glans penis. It's not the head, it's not the tip, it's the glans penis. Here you can see the glans penis with the prepus, the foreskin, going over the glans penis. This is actually a short glans penis because you can see a short prepus because you can see the glans penis there. Very often in uncircumcised males, the foreskin is so long it looks like it goes to a point. Okay? Then we take this model. This model, how come I get in there? You go through all this trouble and all I do is take it apart. Okay. First of all, you'll never look at a penis again the same way. See the monkey face?
Oh, yeah.
See a little monkey face right there? Or you can see the monkey face right there. Okay. So, again, this is the glans penis. This is the corona. This is a circumcised male because the prepus is gone and there's the corona. When we look at this model, this is the testy, this is the epididymis, this is the tunica albuginea. Now when I lecture, I'm going to show you a slide that shows you the inside of the testy, and I'll tell you these are the things you need to know on this slide. But this is the tunica albuginea. Can you see that little red line going all around the outside? See it right there, that little red line right here going all the way around? That's the dartos muscle. And what the dartos muscle does is it wrinkles the scrotum. These that look like rubber bands are the cremaster muscle. The cremaster muscle lifts the testes up against the body. Some guys don't even realize that the testes move up and down all day long.
Your body.
They go up against the body to get warm. They move away from the body to cool down. Optimal temperature for spermatogenesis is at about 97 degrees. It's about 2 to 3 degrees lower than body temperature. Okay? So, when it's cold outside, the testes move up against the body. Now, understand that when a guy wears the brief type of underwear, that keeps these from being able to do their job.
Is that why they have to wear boxers?
If you want to be fertile and be able to make babies, then we take you till you get out of those briefs so they can move away from the body, and you wear boxers or you go commando so that these can do their job, okay? Now, this is the tunica albuginea. It goes in and makes walls that we call septa, and the septa then make rooms that we call lobules, and the lobules are full of seminiferous tubules. Okay, you have about a half a mile of seminiferous tubules in each testicle. Then I'll show you how it moves all the way up here to get to the epididymis. And the epididymis, sperm learn how to swim and they mature, okay? Now, I like to get the real macho guys because this blows them away so that they understand. All men, I don't care how macho you are, have a little bit of vagina in them. See this tissue right here?
What?
This is the tunica vaginalis.
I said you can't perfect timing.
Perfect timing.
So this is the tunica albuginea, and the tunica vaginalis, this white layer, is on top of this layer. Okay, this is on top of this. Now, come here. Give me your hand. When she takes her hand and she takes the testes, bring your fingers up and feel right there. What she's feeling right here is a spermatic cord. Okay? If you look at the spermatic cord has, there's the vas deferens right there, see it? It's got all these little blood vessels. That capillary bed is called the pampiniform plexus. And the pampiniform plexus then gives oxygen and CO2, takes nourishment and waste away from the testes and then the scrotum and all of that. We have accessory glands. So we already looked at the seminiferous tubule over there. We looked at the prostate gland. And then we have this one that sits right there, a little bitty one. See it right there? It actually sits in that urogenital diaphragm. And this is called the bulbourethral gland. So the three glands, the three accessory glands that we have, give me the boy, just give me the top. So when we look here, I have the seminal vesicle, seminal gland. I have the prostate. This is the prostate cut open. This is the prostate here. And I have the bulbourethral gland. When we look at the male reproductive system, we have the testes that's responsible for making the hormones and for making the sperm. And all the rest of the male system is nothing more than conduits and accessory glands. We have from the epididymis, or from the ready testes all the way out to here, it's a pathway for the sperm to get out of the body. And then we have the accessory glands that add to, see, the ejaculate, the fluid that leaves the male during ejaculation is called the ejaculate or called the semen. And people think that it's mainly sperm. It's not. Most of it comes from right here. 60% comes from the seminiferous gland, or from the secretory vesicle. And then some comes from here, some comes from the bulbourethral gland, about 5%. The part leaving the epididymis and moving up, carrying the sperm, is only about 5% of an ejaculate. Okay? And that is the, oh, easy male. Let me see what I want. This one? No. This one. Okay. So when we look, this gray part, this purpley part right here, that's the bulb of the penis. See the little tip? That's the crus, C-R-U-S. The bulb of the penis is the beginning of the corpus spongiosum. That's the purple wrapped around the urethra. The crus is the beginning of the corpus cavernosum. Now there are two cavernosum, dorsolateral. They sit right here on the penis. When they fill up with blood, they cause the erection. When the corpus spongiosum fills up with blood, it makes it larger around, larger in girth. I gotta make sure I did everything. Yeah, I think I did everything. I'll think about something. Okay. The female is a lot more difficult. Female is a lot more difficult because not only does it have to make the oocyte, and not only does it make the oocyte and makes the hormones, but it also is a place for the fetus to grow. It has to undergo a monthly cycle, the menstrual cycle. And then the female reproductive system also has to give nourishment to the baby once it's born. That's what the mammary glands are for. So when we look at the female, take this off first. First of all, again, I don't examine a woman lying on her side. I examine a woman lying on her back. And when I put that woman on her back, here's the belly button up on top. I bring my hands down, and right here is the mons pubis. Mons pubis means the mountain on the pubic bone. There's the pubic bone.
Do you say mons?
Mons, M-O-N-S, the mons pubis. The mons pubis plays an important role. The important role of the mons pubis is during intercourse, Without this padding there, you'd have bone pushing against bone. It's very uncomfortable. And so the mons pubis adds a little bit of padding. Man has the same fat pad as a woman does. Mons pubis is supposed to have hair on it, because by having hair, when she's working outside, and we didn't have air conditioning and things, live inside, they did all the work outside, sweat would come down, carrying bugs and everything else, it'll get caught in this hair. And then we move down, and right here is the labia majora. The labia majora has hair on it. It's designed to move the dirt and the sweat around the opening to the vaginal vault and the urethra. So this is the mons pubis, this is the labia majora, and then we have female part. Give me that one. I got it. And then, medial to the labia majora, we have the labia minora. This space between the labia minora is the genital vestibule. Space between the labia minora. If I go to the bottom, posterior part of the labia minora, and I follow it up, it brings me right here to the glans clitoris. The glans clitoris is analogous to the glans penis. Same kind of excitatory erectile tissue. Just like the glans penis had a prepuce, the glans clitoris has a prepuce. See this blue part? That actually is a covering of the glans clitoris. And upon excitation, the glans clitoris becomes erect just like the penis, and it'll stick out from underneath the prepuce. Now, most people think that this is all there is to the clitoris. That's not true. All of this is clitoris. This is the body of the clitoris back here. Then we have the bulb of the vestibule. And then right here, we have the greater vestibular bulb. So this is the bulb of the vestibule. It looks like the blue peanut, see it? And this is the greater vestibular bulb. It's also called the Bartholin's gland. They have the job to moisten the vestibule. That way, the bulbourethral gland moistens the glans penis and underneath the prepuce. The bulb of the vestibule and the greater vestibular bulb moisten the vestibule, and then you have a moist penis going into a moist vaginal vault, and intercourse isn't supposed to hurt. So we already know that it is 1, 2, 3, urethra, vaginal vault, anus. When we look at the vaginal vault, this is the opening into the vaginal vault. See these ridges? The same kind of ridges that we saw in the urinary bladder, the same kind of ridges we saw in the stomach. These are rugae, and so what do? It allows it to stretch. Vaginal vault goes from this size to that size. And thank God it's a muscle, and it goes back down. Okay? Now, yeah. When we move into the vaginal vault, now this is, she's on her back. We move into the vaginal vault, you see this little indentation coming back right here? This is called the posterior fornix. And this one is the anterior fornix, where it goes back. The cervix sticks down into the vaginal vault, and this would be the anterior fornix, and this would be the posterior fornix. What the literature says is the posterior fornix is where the semen gets deposited upon ejaculation by the male. You do understand that that's problematic. It's situational. Understand that all these things that we study in A&P were written by white guys from Europe. And so when they went to Africa, when they went to the Polynesian islands, they looked at them and said, oh, look at those animals. They're having sex like the animals do. And the people from those countries looked at those white boys and said, look what they're doing. They're nasty people, laying on top of that woman. That's why they call it the missionary position. If we have the missionary position, then yes, it's going to get deposited back here. But if the male is behind the woman, then it's going to get deposited over here. See what I mean? But the literature will tell you it gets deposited here. depends. She could be laying on her side and get deposited over here. You do know women can lay in all kinds of different positions. Guys, we just have one. Okay. See the thumb right here? That thumb right there? That is the cervix of the uterus. Cervix means neck. So this is the neck of the uterus. It's got this opening right there. That's the external ostium, or the external os. And it has that opening right there that is the internal os. See this light pink?
How do you spell it? External?
Os, O-S. And right here is the internal os. See the light pink and the red? That makes up the endometrium, the inside layer of the uterus. But then we come back and we divide this into two pieces. The light pink is the stratum functionalis, and the red is the stratum basalis. What happens is every month when a woman has her menses, it is the stratum functionalis that's leaving the body.
The pink one?
And the stratum basalis, the red one, makes a brand new stratum functionalis every month. So it's a nice soft landing for that fertilized oocyte when it goes to implant itself into the uterus. Now, this one out here that looks more muscular, that's the myometrium. And the white one out here is the perimetrium. And covering those, see this light pink all in here? All that light pink? That's the broad ligament. And the broad ligament on this model, can you see it all right here? All of this is broad ligament. The broad ligament holds everything in place. It holds the ovary, it holds the urinary bladder, it holds the fallopian tube and the ovary, it holds everything in place. And then it comes up here and becomes part of the peritoneum. Okay? There's a whole lot of different ligaments that hold the uterus in place. But we're going to be able to look at this one. This is the ovary. And so that one right there is the ovarian ligament. This one is the uterine tube. We used to call it the fallopian tube. When we look at the fallopian tube, it looks like this. Okay? From here to here, this is the infundibulum. Wiggle your fingers. And that's the fimbrae. Upon fimbrae, F-I-M-B-R-A-E. What happens, they look like little feathers. And what happens is when a woman ovulates, these start waving, looking for the oocyte. Now, they always show it like this. It's not like this. It's like this. There's a space. And that's why it's important that these start waving, looking for the oocyte, because it could come over here and it'll pick it up and bring it into the uterine tube. When we look at the uterine tube, this is the infundibulum. This, where it swells up, is the ampulla of the uterine tube, just like we had the ampulla of the vas deferens. And then it gets skinny just before it goes back into the uterus. So when we look here, all of this dark red is the infundibulum. See the fimbrae look like little feathers right here?
Is that what you said?
That's right here. That's the fingers right there. See them?
Oh, okay.
And here to here is all the red. Where I told you it swells up, see it swell up right here? That's the ampulla of the uterine tube. And then it gets skinny right here going back into the uterus. And that's the isthmus of the uterine tube. This is an ovary. Well,
What?
an ovary. That little egg-looking thing.
Oh, okay.
This is the ovary. So this is the ovarian ligament. Told you we have the broad ligament. If we look back here, all of this back here is broad ligament. If you look right here, this space between the ovarian ligament and the uterine tube right here, that's this. This is the mesobarium. Okay? M-E-S-O-B-A-R-I-U-M. That's the mesobarium. Now, see all the little blue dots all the way around? It's called the germinal epithelium. But it doesn't really germinate anything, but they thought it did, so they called it the germinal epithelium.
Germo?
Remember?
I'm sorry, germo?
Germinal, G-E-R-M-I-N-A-L. Remember this one? I called it the tunica albuginea of the testes. See that little white cloud underneath the germinal epithelium? Excuse me, all the way around? That's the tunica albuginea of the ovary. So on the test, you would put tunica albuginea / testy or tunica albuginea / ovary. You can't just write tunica albuginea because I get to say I don't know which one you're talking about and mark it wrong. Okay? Now, this is the medulla where all the blood vessels are. And this is the cortex out here where everything is. Okay, now, this can be called an egg nest, but you're going to call it primordial follicles. I want you to think of a follicle as the eggshell, and the oocyte is the egg inside of the shell. So this is a primordial follicle, and that little blue dot then would be the oocyte. So I have a primordial follicle, and they develop into a primary follicle. See this one? It's got one ring of cells. See it?
Primary.
That's a primary follicle. And then some of them become a secondary follicle. See this one with two rows of cells around it? The other thing is, see that little teeny tiny black line right there? That little teeny tiny black line is called the antrum. And that antrum is A-N-T-R-U-M. That antrum is going to fill up with the liquor, with a fluid called the liquor folliculi.
Liqueur. Follicular.
L-I-Q-U-E-U-R. That little black line is going to become this great big opening. And this is the antrum, filled with that liquor folliculi. Where'd it go?
What is that on the side? I'm sorry. That looks like a spider. Oh, that's where you're going next. I'm sorry.
Is that it? Is it that one right
This one right here. This one, this one has not ovulated. Because see, this is the opening. See this one right here?
That's an ovary.
This is a tertiary follicle. The whole thing is an ovary.
Oh, that, okay, that's a.
I had a primary, a secondary. This is a tertiary follicle.
Oh.
And it hasn't ovulated yet because that oocyte is facing into the follicle. Upon ovulation, that liquor folliculi flushes that oocyte out of the follicle. See it?
Oh.
Now there's a little white cloud around that oocyte, and that's called the cumulus oophrus, and what it does is give nourishment to that oocyte. Now,
Cumulus who? I'm sorry.
cumulus oophrus, O-O-P-H-O-R-U-S. Now, as soon as this one ovulates, it collapses, and these cells become the tunica hemorrhagicum. We call it hemorrhagicum because look at the little blood coming out of it. See it? It's like you popped a pimple and have that little bit of blood coming out. So this is the tunica hemorrhagicum. Understand, you will never see this blood. This is way up in your body. This is not your menses. It very rapidly becomes the corpus luteum. Corpus luteum means yellow body. Only problem is it's not yellow in human females. It's actually white. But it is yellow in other animals, and they studied the other animals first, and so they still kept calling it the tunica, or the corpus luteum. And then it becomes situational. If a woman ovulates, and this oocyte does not get fertilized, this corpus luteum becomes the corpus periodicum because she has her period, right? If this oocyte does get fertilized, then this becomes the corpus gravidicum, G-R-A-D-I-V-I-C-U-M, the corpus gravidicum. Gravidicum actually means pregnant, okay?
So this I'm sorry. So say that one more time. If the oocyte
gets fertilized,
okay,
this becomes the corpus gravidicum. If it does not get fertilized, this becomes the corpus periodicum. Just remember the woman has her period, so it becomes the corpus periodicum. The corpus luteum makes estrogen and progesterone, but maintain, listen to what the progesterone does. The progesterone maintains the pregnancy. So if she ovulates and it doesn't get fertilized, this is going to stay making progesterone for about 10 days, 10 to 12 days. And then the progesterone level drops off and the woman has her menses and we start all over again. If this does get fertilized, this is going to remain the corpus luteum for about 12 weeks. And then the placenta embeds itself in the uterus, and it takes over making progesterone. In the meantime, the function of this progesterone is to maintain the pregnancy. Okay? This is looking at this is a heavy breast too. Got it?
Oh my God.
It's heavy. I don't know why they made it so heavy. Anyhow, understand that most of the breast tissue on a woman is adipose tissue. It's fatty tissue. Any woman will tell you guys, as soon as they start losing weight, the first place they notice it is in their cup size. It changes. So most of it is fatty tissue. See these purple lines here? Those are suspensory ligaments. Their job is to hold the breast in place.
How long does that last?
It varies. If you spend a lot of time without a bra on and you don't have support, not very long. Now, it's going to last longer on small-breasted women than it is on large-breasted women. You have more of a pull of gravity. And so large-breasted women have to make sure that they have bras that fit them and support them. Otherwise, they're going to be tucking their breasts into their belt line when they get older. Okay? So that you don't want to. Now, when you're pregnant and your breasts enlarge because the lactiferous glands get bigger, you absolutely have to have a supporting bra. Okay. So then we get to the lactiferous gland itself. When a woman is making milk, she's lactating. So these are lactiferous glands. These make the milk. Now, think of it like a cluster of grapes. That's a lobe. The individual grape is a lobule. And in the lobule, we have alveoli. And that's what makes the myoepithelial cells are what's going to push the milk out. Now, see these little purple tubes coming up from the lobe? Those are lactiferous ducts. And they're taking milk up here to the nipple. But right here, look at them, they enlarge. See them enlarge right there? That's a lactiferous sinus. Now there's about 15 to 20 lactiferous ducts and lactiferous sinuses, so that if a woman were lactating and the milk is first starting to come out, she's getting ready to breastfeed, I'd see 15 to 20 little white dots of milk.
I have a question. So when they get like their nipple squares, can like they close like a duct or something like this?
Well, it's going through the ducts. And so then if they got pregnant later on and they wanted to breastfeed, they may have difficulty because there's scar tissue there. Right. Now, this is the nipple. It can become erect, sort of like the penis and the glans clitoris, but it's a different kind of erection. This is a mechanical erection. This is muscles tightening up. This brown area is the areola. And in the areola, if you look very closely, there's little bitty glands. Those are sebaceous glands. We used to call them Montgomery glands. They have a function. And what those Montgomery glands do is they're supposed to keep the nipple supple so that it doesn't chap. Trust me, when that baby latches on, people think it sucks on the nipple. It doesn't. It sucks on the whole areola. And when it latches, it latches. And when it starts sucking, you got a moist mouth on the nipple. And as it nurses, women have been known to get really bad chapped nipples. You've seen chapped lips real deep into the lip. You'll see real bad chapped nipples, cutting way down deep into the nipple. It hurts like crazy. Watch women stand there trying to breastfeed with tears running down their eyes because it hurts so bad. And I don't know why nurses let them do it, because all we have to do is we take a regular baby bottle nipple, put it over her nipple, and let the baby suck on the nipple. They'll still get milk. More importantly, I would have asked you, Tanya, when you first came in and we said you were pregnant, I'd ask you right then and there, do you plan to breastfeed? If you tell me yes, then you're going to start getting your nipples ready from day one. Because if you don't, you're asking to have chapped nipples. And when I tell you to get your nipples ready, you take a shower with the soft washcloth and you wash your breasts, giving attention to the areola and the nipple. When that no longer bothers you, you get a rougher washcloth and you wash. And when that no longer bothers you, you get a rougher one. You need to get to the point. You know those little brushes that we scrub the baby's head with? You have to be able to take that little brush and scrub your nipples. But you've toughened up your nipples. And it doesn't bother you because you're going to be able to breastfeed as long as you want if you do that. So I usually get questioned, how long can a woman breastfeed? As long as you want to. As long as that baby keeps nursing, you'll keep making milk. Now, I've had patients that have babies 3 and 4 years old, and they're still breastfeeding. My rule is, that little sucker gets teeth, you're off the nipple. Had a patient come in. Husband comes flying up to the emergency room. We go out there, and she has blood all over the front of her shirt. I thought she got shot. That's how much blood was there. We bring her in, I open up her blouse, and her nipple's hanging there. Had a 2-year-old she was breastfeeding. She wanted him off the nipple, and he went. I'd have been in jail for child abuse. That baby would have hit the wall. Okay? There's actually jobs in Germany that's their job. They get up in the morning, they go to the factory, they get milked, and they go home. They go back at noon, they get milked, and they go home. They go back in the afternoon, they get milked, and that's their job.
Just a breast?
Yeah, you do. They pump their breasts, and they put it in bottles, and you can go to the store in Germany.
Can you make yourself lactate?
If you stimulate your breasts enough.
Yeah, you get the pumps.
If you get a pump and kept pumping your breasts, yeah.
I mean, but you
Now,
have to
you
be
need the
pregnant.
hormones. You need the hormones.
You have to be pregnant though first, right?
Yeah, I can give you prolactin.
Oh, yeah.
There's certain medications that will make.
Yeah, we can give you medication that'll make you lactate.
Oh, but she was breastfeeding. But she was just doing it. The baby wouldn't get no milk.
Now, to me, if that boy can come up there and lift your shirt and lower your bra, and he needs to get off that breast. That then becomes daddy's job.
He's too old and young for that.
See, daddies get very jealous. Mothers start breastfeeding, and daddies don't even think about it. That's the baby. I was here first.
You know they have vests now for men. They can breastfeed.
It ain't
now?
the same.
I know, but I'm just saying I
It
saw
ain't.
that. And I
When
thought
I
that
was in newborn
crazy.
nursery, I was the only man working in a
They do
newborn
have a
nursery.
vest, and the mom puts the milk, her milk in